All right. So thank you so much, Guy Jones, for your video. So we've had already questions here. We can see. So let's just have a bit of discussion. So, well, the loop does it operate even after parties?
So one of the things that is always a challenge for any small health organization is the challenge of how do you fund the service and how do you pay for it. And it's been a lot easier for us to get funding to raise money because we don't receive any government funding. It's been a lot easier to raise money to support the service at a music festival because the music festival will contribute the majority of the cost. And we know that at that music festival, let's say 10% of the people at a 40,000 person festival are taking drugs. Well, there's 4,000 people there who need the service. And all weekend, we will be really, really busy. When we operate, as we have done 4 or 5 times in the city, we tend to be much less busy because at any given moment, fewer people will be aware of the service, and maybe only 1% of the people in a city of 400,000 people are using drugs. So although that's the same actual number of people, they are spread out over a much bigger area, and it's more difficult for us to reach them. And so up until now, we haven't done as much testing. And of course, also, there's no music festival who will pay the costs when we're operating in the city. So it's something that we really want to do because not everybody who uses drugs can afford to pay £200 to go to a festival to have their drugs tested, right? That's really expensive. So we want to make sure that people who have less resources, shall we say, who are more vulnerable, can access the service.
All right. So we really need that access to service now. Now, if I may just share, we have this particular case. Substances, they are like the SARS-CoV-2 virus. No, they have variants. So there was this. We've encountered a case of, I think it was MDMA. So, and it was a different type. It was the orange Trump, and that guy was hospitalized. And good thing that he managed to. So we us here in the Philippines, we don't have that. We don't know where to have our drugs checked. That's our problem here. And at least there, you have your program with the Loop that does that service.
It's really difficult.
There's
ahead. A lot of people kind of around the world that don't have good, easy access to drug checking services. There are paid services in the US and in Spain that will accept samples from all over the world. In the US, I believe they charge $40 for an ecstasy tablet, but it's $100 for any other sample. And in Spain, I believe it's €70 for any sample. So it's not something that you can just, if somebody uses drugs every week, they can't send a sample off every time because it costs $100 and it takes 1 week for it to arrive in the mail, 1 week to wait in the laboratory, 1 week for the result to be posted, and okay, I took that 2 weeks ago. So yeah, I really think there's a big issue with easy access to testing services. And to ask a comment, to answer a question from Matt Southwell, and also a little bit that talks to Miyuki's question. Therefore, allowing access to people outside of events and when the Loop is not running, the best thing that I can suggest for that is that people use the at-home reagent testing kits. So this is that's my normal job. Is I run Reagent Tests UK, and we sell home reagent testing kits for people to use. It's not as sophisticated as a full laboratory test, but it at least allows that you can see, is this possibly the substance that I expected? So let's say for MDMA, it should go purple. And if it doesn't go purple, bam, you immediately identified this is not MDMA. Maybe you don't know exactly what substance it is, like it went orange and you're not really sure which substance went orange, but you know your dealer either lied to you or he doesn't know what he's selling. and both of those situations are really bad, and you should just put the drug in the bin because you don't know what it is. So that's one of the ways that we can help to reduce harm outside of festivals. And harm reduction is always, we always have to use multiple different strategies. So with the Loop service, we join together the drug checking and testing, and then we also add to that the healthcare consultation. So we're mixing together the testing and the advice is like a 15-minute long session, and we really talk to them about lots of different strategies that they can use to reduce risk. And so that's one of the big values of the service, is that we get people to come in and receive that information that they wouldn't normally have. So yeah, there's lots of different strategies that people can use. For us as a service, we try to reach people proactively, but for if people are interested in taking a role in their own health, then there are lots of resources available online for them to look at.
All right, thank you for that. And we have a question from Ms. Jonna Roldan, a graduate of DLSU, De La Salle University. Considering how drugs are currently viewed in the Philippines, what can you suggest for us to slowly have a similar services or initiatives as the Loops? At least aside from continuing drug education and awareness.
It's, I mean, you kind of saw how the Loop service began, that it started with Fiona Measham, who's a professor of criminology at Durham University. And she used the existing relationship that she had with nightclubs and with police in Manchester, because her area of research had been that for the last 15, 20 years. So she had some existing relationships, and she wanted to kind of do some research on what are the substances that are appearing at nightclubs. And so I think it kind of says to me that it's worth using whatever relationships and whatever resources you have just to get, what we would say in the UK, a foot in the door. That if you can start something, starting with anything, it's a start. And from there, yes, it takes literally years. It could take 2 years, it could take 10 years. But you're there, you're talking to people, you're building relationships, you're showing the professionality that you can exhibit. And over time, they begin to respect the expertise that you have. And I think that's the way that I would approach it, is to just start doing something and try as hard as you can to build it from there.
Start doing something. So I could recall that it started with just a study, right? So the problem with that here is, it is because of our current existing laws. No, we are somewhat limited with our current existing laws about it. Mm-hmm. So I'd like to ask, if were there any amendments in the laws of UK, of United Kingdom, to further support what you do?
The answer is definitely no. And this has been a real frustration for us, that actually the specific wording of the law is kind of set up. So, for example, we cannot receive the sample and give it back, because if we give anything to anyone, even if they gave it to us first, then we are considered to be a drug dealer. It's supplying drugs. And so that is a challenge for us, because anybody who is very poor and they want to give us a small amount of drugs and then take it afterwards, we aren't able to do that. We don't have the ability to operate like what we would call an overdose prevention site, where somebody has their drugs checked and then they go in that site, they can consume it, and there are nurses and doctors there to make sure that they don't overdose. That's also something that we can't do in the UK, but that is possible in Canada. And I believe there are other countries also operating similar services. So we definitely have some big barriers in the law in the UK. And even just for the Loop service, technically, we probably shouldn't be doing it. But because we have this relationship with the police, we say to the government, hey, we are here as like employees of the police. They're not paying us any money. We're not really employees, but they are allowing us to be there, and the police are allowed to handle drugs. Sure, they can, they don't need any license or anything. They're the police. And so when they say to us, okay, we want you to test these drugs for us, then we're allowed to do that. And we just have to give them the drugs to the police at the end of the day.
Right. Thank you for that answer. So we have here from that. Was this already answered? After drug checking, do you have also a sort of booth where concert goers can safely consume?
Yeah. So certainly for concert goers, the kind of demographic is young people between the age of 18 and 25. Once they receive the information from us, they don't want to hang around in our boring tent with white lights and no music. They want to go to the festival and party. So that's what they do. I think if we offered that space, then people wouldn't stay. Like they're not. Yeah, they want to go out and enjoy themselves. And once we've equipped them with some information to try and reduce the risk of doing that, they're quite happy to do that. And certainly in the UK at a music festival, the way that somebody would use drugs is not to take them all at once and just kind of sit there enjoying the drugs. They will take small amounts continuously through the night, and they will be kind of focused on, I'm here to enjoy the music, and the drugs are an extra addition to that. Sure, some people will take too much and they will not be able to focus on the music, but the majority of people are going there because they want to go and watch their favorite artist.
All right, so thank you. What risk that an organization who provides at-home reagent test kits should expect?
I guess I can sort of share with you some of the challenges that I've had providing at-home reagent tests. There's lots of, I guess, possibilities. Like at the beginning, I was very worried that somebody would use the test and they would read the result and they think, okay, my sample is the drug that I think. And then they take the drug and they go to the hospital because they are really unwell, and that they might sue me and say, well, your test told me it was this, but I still went to hospital. And there's two possibilities there: that they misread the outcome of the test, or that the outcome of the test was correct, but they just took too much anyway. Because even a pure drug can definitely be dangerous. We all know this, that pure MDMA can be dangerous. A lot of deaths in the UK come from that. Pure cocaine can be dangerous. It really disrupts the rhythm and the heartbeat, and that causes a lot of people to die in the UK as well. So that was something I was really worried about. That never happened. A lot of the things that I was sort of worried about with getting sued, well, it's been 6 years and so far nobody has sued me. The challenges that I have had have been related to kind of normal business challenges. I've really struggled with having access to banking services because they see, in the beginning, I was trying to be really honest about what the company does and why it exists and who I'm trying to help. And the banks didn't like that. They said, well, that's drug paraphernalia and we are freezing your bank account and goodbye. So that's been a real problem for me. The answer has been that now at this point, I accept cryptocurrency, so the private cryptocurrency Monero, and I have changed the website to be really boring and really like, oh, we are testing for security services and we provide tests to the police. The police are really not the main customer. That's not who I'm trying to help. But if I tell the bank that, then at least they will allow me to have a bank account. And that is something really important. And then the final problem that I faced is from the authorities, but not in the way that you would think. The police in the UK, not interested. But I've had 2 inquiries from the authorities about selling explosive precursors. And one of the ingredients that's used in reagents, sulfuric acid, can possibly be used to make explosives, but not really. And another, that there is now a law in England that you cannot sell strong acids because they could be used by a gang to attack someone. So they would throw acid on somebody's face to cause really severe injuries. And so the law says that if you sell these, then when you make the delivery to their home, you have to check their identification. And of course, if you are buying a drug reagent test, you don't want to provide your identity, right? And also that increases the cost of delivery. So that's been a challenge, and we've had to change the formula in order to do that.
So somewhat there is still this stigma and discrimination towards our certain advocacy, right?
Yeah, but I think that it's funny to me to think that the police aren't stigmatizing it. The authorities, they're not coming for me because of drugs. They're coming because the law says you can't sell acids. The people who are stigmatizing it are the banks.
Right. Now we have a question from Matt Southwell, a consultant of COA. What are the backgrounds and motivations of the people who volunteer for Loop?
So we have a pool of maybe 500 volunteers now after 7 years of operation. And that consists of about 300 people who have a chemistry or science background, and maybe 200 people who are doctors and nurses and healthcare workers. And then actually we probably have about another 30 to 50 people who are like media professionals who help us with social media and admin and things like that. And we ask that everybody who volunteers must have like a professional qualification in that area, because otherwise we would probably have 5,000 volunteers. There's a lot of people who really this resonates with, and they have a little bit of knowledge, usually from their own history, and they want to give back. They want to help people. They want to, in some cases, help people avoid making the same mistakes that they did. Or other cases, they just want to make a positive difference. And I think certainly something that I recognize is the level of knowledge about drugs is so low that even a very small addition to that knowledge can have a really big impact on somebody's health. If somebody doesn't know about correct hydration on MDMA, or that you should not mix Xanax and alcohol, those are huge risks. And if we can just spend like 1 minute to educate them about that, then that could quite literally change their life. And so I think there's the people who volunteer see the potential to do something really good, and they're really interested to do that. So yeah, I think their motivation is kind of really pure, and it's actually really, really enjoyable to work alongside people who have goals like that, because we're all there for the same reason, and everybody wants to just help other people. It's really good.
All right, so thank you. Oh, is testing voluntary?
Yeah, so, and I guess this speaks, like, we don't want it to be a coercive thing. We want people to want to use the service, and at a lot of the events that we go to, people will queue for like an hour to use the service, completely voluntary, because sometimes we are just so busy that we can't test the samples fast enough. Like on a Saturday afternoon at a music festival, that it's the busiest night of the festival. It's 4 p.m. Everybody just woke up at like 2 p.m. And they all come at once, and we just have this massive queue. At our busiest event, we tested over 500 samples in one day. And this is all 100% voluntary. Like, not everybody at the festival even knows about it. And they want to use the service. They really want to improve their own health. Nobody wants to go to a music festival and spend their time in the medical tent. So yeah, it's completely voluntary, and nobody is forced to use it. It's just, if you want to, then you can. And I think that's one thing at the very beginning, in the first year, people were really reluctant. They thought, oh, maybe it's a police like trap, and they didn't want to come and use it. Now we've been in the newspaper, we've been on the television, and people are starting to realize, oh, this is an actual thing that's for my benefit. These people are here to help me.
All right, so thank you for that. Now, Now, there's a question from Mon Sebastian. What are the essential things an organization group need to initiate a safety testing booth center, like a starter kit, if you may? Mhm.
I suppose it depends. Like, there's a lot of different ways that you can run a drug checking service. The most sophisticated services have, like in Austria, have maybe several €100,000 of funding. They have a van that they drive to the events, and all of the testing equipment is in the van. And they just turn on the equipment in the back of the van. And like, as a chemist, I just dream about this. It is state of the art. It's incredible. But we don't have that funding. Many organizations will not have that funding. The equipment that we use costs around, I would say it will probably cost about £20,000, so maybe 30,000 US dollars to set up. And so still, that's quite a high level for starting the service. What we've seen with the organizations working with the lowest budgets, and this tends to be kind of like what we call a grassroots organization, where it's just people who are like, I'm upset, I won't stand for this, I'm going to do something myself. And they tend to use the at-home reagent tests. And there's also a technology called thin layer chromatography, where you put a small amount of the sample onto like a silica sheet, and then you put the sheet into a solvent, and just like a piece of tissue in water, the solvent traces up the sheet. Can you see that? It traces upwards, and it carries some of the substance with it. And different substances move at different speeds, and so you get like a separation of the different substances, and then you can put the reagent test onto the silica sheet, and you see the different spots, and you can then see what is in the substance. You don't get any percentage information, but at least you get to know what is there. And so the setup for that might cost sort of less than £500, probably maybe even less than 200. And then, yeah, once you've got that, I would say, and I can't really emphasize this enough, the truly essential part of it is the education. All different kinds of technology, doesn't really matter which one you use. The key thing is, do you have something that is going to make people want to come and receive the education that you can give them? How can you equip people with this information? And it's that information that is probably going to be most likely to keep them safe. Even if their drugs are adulterated and they're still going to choose to use it, you can give them information to say, okay, well, we're not quite sure what this is, but you paid $50 for it. You're not going to throw it in the trash. And so if you are going to use it, you need to start with a small amount. Make sure that you are eating well. Make sure that you sleep the day before. And try to just equip them with as much information as possible, that if it's not the substance they expect, or even if it is the substance that they expect, that they're going to avoid as much harm as possible.
Wow. Chemistry is just amazing. With magic with chemistry, right? You mentioned earlier about £500, and I just converted it. It's 33,000 pesos in the Philippines, and that's too much. It's even beyond my salary.
Right.
We have a question from Jay. Oh, say it. Go ahead.
I would say you could probably do thin layer chromatography for like, if you had somebody who was a chemist and was willing to make all of the stuff, then I would say you could probably do it for about 66,000. So we're getting there, but yes, it's still expensive.
Yeah, it's still expensive. Now we have a question. Drug use does not stop despite the lockdowns. I'm curious, how does this service work during the pandemic? How did you adapt?
This has been something that's difficult for the Loop, because trying to run a face-to-face service, we can't do that. Trying to operate, like, most of our reach is of people who are using drugs at music events. We have a lower reach to the demographic of people who are problematic users. And so all of the music events stopped. completely. We don't have that ability to run our service there. And as I mentioned before, that's how we can run the most cost-effective service, because we have the highest concentration of people who use drugs in the smallest area. So we've just been generally doing kind of like online outreach, trying to give information to people through that, encouraging people to use the at-home testing kits. But sure, this is certainly a challenge, and it's not one that we've necessarily conquered. We've also had a lot of, I would say, bureaucratic work that we've needed to do. And so to a certain extent, we've been using this time to complete that bureaucratic work so that when festivals start operating again, we can 100% immediately. So yeah, that's kind of been our approach to the pandemic.
All right, so thank you for that. Well, as per Matt Southwell, Loop has a very good reputation among drug users in the UK. So we would like to acknowledge that fact.
Yes. Yeah, and I think part of that is because when we're giving out information, we don't give an alert about every single substance. We are really thoughtful about when we make a public communication. And when we make those communications, we're really thoughtful about them, that we're not trying to just scare people. We're not trying to say, hey, all drugs are really bad, don't take drugs. We're thinking about how can we get people to trust the information that we're giving? And the way to do that is to be really honest about, this is the strength, this is what's in it, this is some of the risks. We're not going to say, even though it's a really horrible substance, say one of the ones we've seen is N-ethylpentalone. The appearance is like MDMA, but the enjoyable effects last for 1 hour. And then for 6 hours afterwards, you cannot sleep each time you take a new dose. So the effects last 1 hour, and you say, oh, the effects are stopping. It's not enjoyable anymore. I'll take some more. And you keep doing that through the party, and you take 5 doses. Well, now you cannot sleep for 5 times 6, 30 hours. And that's a really horrible experience for somebody who has already been awake for 24 hours because they were partying the night before. So it's really horrible. People wouldn't want to take it. But instead of just saying, drugs are bad, don't take this drug, we're saying, okay, the drug is called N-ethylpentalone. These are the effects. If you do decide to take it, make sure that you consume small amounts, that you don't keep taking more to try and chase the good effects, because they won't really come back. And so by doing that, we're building trust and showing ourselves that we have expertise, that we trust the people reading the information to make the right decision for them. And all of that works together, that they can then feel that they can then trust us to provide the correct information. And that goes a long way to build up a really good reputation.
All right, so thank you for that. Now, I am curious. Well, here in the Philippines, the most common choice of drug is methamphetamine, or we locally call it shabu. I'm curious, what's the most common there in the UK?
In terms of the general population, well, first of all, alcohol, caffeine, of course. But this is completely legal alcohol over the age of 18, and caffeine, I don't think there is any restriction. In terms of illegal drugs, the most popular is cannabis, and a very large portion, as much as 50% of the population have tried cannabis at least once in their life, and about 20% of the population have tried cannabis in the last year. So that's quite high prevalence. Then we see cocaine and ecstasy. Between 5 and 10% of the population will have tried that in their life, and between 3 and 8% will have tried it in the last year. So that's really a lot of what we are addressing. Methamphetamine is actually really uncommon in the UK, and there's not a really obvious reason for, well, the weather is different in the UK, so nobody takes methamphetamine. There's not one single thing. My personal hunch is that methamphetamine struggles to have prevalence in countries where MDMA is more readily available. because most people, if they want to party, they don't want to take a dose of the drug at 11 p.m. and still be awake at 11 a.m. the next morning necessarily. And they especially don't want to take their final dose of the evening at 4 a.m. and they then can't sleep when they go home at 10 a.m. because it lasts 12 hours. MDMA has a much shorter duration, between 4 and 6 hours. It's a stimulant, so it allows people to party. And so if people are going to choose one of those two, well, they're probably going to choose the one that lasts for 6 hours, so that they can go and party, but then when they get home, they can sleep. But if you can't access MDMA, methamphetamine is much more easy to manufacture. So if the authorities really clamp down on MDMA and prevent it being available, then it makes sense that methamphetamine is going to be more available. So that's my personal theory that I think is underappreciated, as well as the other factors that may affect methamphetamine availability and popularity.
All right, so we have a message here from Maria Cecilia Zamora, Assistant Professor of UP SED and ATCPD. Do you ask permission or consent from party goers? There might be a confusion between drug checking versus drug testing.
Yeah, so certainly we're always testing the white powder or the pill. We're never testing any of the bodily fluids or the hair of the person using the service. And it is entirely a voluntary service. So when people come to us, we kind of asking them, can we have some of your sample? And we will give you the test result. And what we do is, in order for them to kind of use the service, we do read them a little disclaimer that just helps them to understand what the limitations of the testing service are. We aren't really we can't test any plant material. There is a chance that if there is something under 1% of the sample, we wouldn't be able to detect that. And so we ask them and we make sure, do you understand that this isn't perfect? That the lab test, we're designed to be as fast as possible, so that we can talk to as many people as possible. And that means we can have that educational engagement with as many people as possible. We're not designed to detect every single molecule in the sample. We're really there to try and pick up on what is making the major contribution to the risk when somebody consumes this. Everybody who comes to use the service, once they're told that, they're like, yeah, sure, I agree to that. I understand. And also there's something to point out that, even the pure drugs can be dangerous. We have a lot of deaths in the UK because the purity of MDMA is very, very high. Most of the samples are over 90%. And so we have to make sure that people understand that even if they check their sample and it comes back 100% pure, that does not mean that they are safe. It is just about controlling and understanding the risk that they're being exposed to.
All right, so thank you for that. And we have from Matt Southwell, patterns of drug use have changed during lockdown. Less MDMA as a collective dance drug and more alcohol, cocaine, and other drugs, more suitable for home use during lockdown. Likely rise in computer purchased novel psychoactive substances. So thank you.
I think I'd agree with that. Like from the kind of surveys and stuff that we've done, that definitely seems to be a trend that we've observed. What I don't know, I'm very optimistic and expectant that when the lockdowns kind of run to an end, that we're going to see a reversal of that trend. That people are, and if anything, that could be the problem in itself, that we suddenly have a big surge of people using MDMA that have not used it for a whole year, that they don't have any, their body doesn't have any tolerance. And so they take the dose that they used to take every week, and it could have a really, really strong effect. So that's one of the things that we're going to want to be doing when we're engaging people with this risk reduction education is to make sure that they're aware of how tolerance works in the body and that they need to take a lower dose than before if they haven't taken it for a long time.
Um, so, Guy, any final words that you would like to share to the people in this session?
I suppose my big takeaway is the chemistry of drug checking is really important. But the reason for that is because it makes people want to come and listen to the risk reduction information. Um, I don't think a drug checking service should run as only giving the test results. I think it's really important that people get to talk to a healthcare professional at the same time. And if you are thinking about setting up any kind of drug checking service, then my answer is just look at what is possible and just try something. Just do something. Maybe it won't necessarily succeed, but it's, I think, about persistence and perseverance, and you just have to keep chipping away and trying to get somewhere.